अस्सलाम वालेकुम। हमारा आज का टॉपिक है एंटी कैंसर ड्रग्स। लेकिन एंटी कैंसर ड्रग्स को पढ़ने से पहले हम कैंसर को स्टडी करेंगे। कैंसर एक ऐसी बीमारी है कि जिसके अंदर हमारी बॉडी के सेल्स अनकंट्रोलेबली डिवाइड करते हैं और उनको कोई फंक्शन असाइन नहीं होता। कैंसर एक सिंगल बीमारी नहीं है, इसके अंदर 200 से ज़्यादा मुख्तलिफ बीमारियाँ शामिल हैं। कैंसर या तो एक पार्ट तक भी रह सकता है या तो ये बाकी बॉडी पार्ट्स पे स्प्रेड भी कर सकता है। ब्रेस्ट कैंसर पाकिस्तान में सबसे ज़्यादा ग्रो करने वाला कैंसर है। लंग कैंसर मेन में कॉमन है और ब्रेस्ट कैंसर वुमन में। ट्यूमर्स की हमारे पास दो टाइप्स हैं, यानी एबनॉर्मल मास ऑफ टिश्यू जो कि अनकंट्रोल्ड डिवीजन से बन रहा है, जिसको हम कैंसर कह रहे हैं। उसकी दो टाइप्स हैं हमारे पास, बिनाइन और मेलिग्नेंट। बिनाइन ट्यूमर ऐसा ट्यूमर है कि जो इजीली रिमूव हो सकता है, ये स्प्रेड नहीं करता बाकी ऑर्गन्स पे या बाकी टिश्यूज पे। ये स्लो ग्रोइंग है और ये यूजुअली कैंसरस नहीं होता। मेलिग्नेंट ट्यूमर कैंसरस होते हैं, इजीली रिमूव नहीं होते, बाकी बॉडी पार्ट्स को इन्वेड करते हैं और रैपिड ग्रोइंग होते हैं। हम कैंसर को उसके सेल की टाइप के बेसिस पे क्लासिफाई करते हैं कि जिसके अंदर हमारे पास सार्कोमा एक कैंसर है जो कि डिराइव्ड है एपिथेलियम से। कार्सिनोमा ऐसा कैंसर है जो कि डिराइव्ड है एपिथेलियम से। सार्कोमा ऐसा कैंसर है जो कि डिराइव होता है कनेक्टिव टिश्यू से। Lymphoma and leukemia are the two classes of cancer which arise from the blood forming cells. जर्म सेल ट्यूमर हमारे पास टेस्टिकल्स और ओवरीज में प्रेजेंट है। ब्लास्टोमा हमारे पास एक ऐसा कैंसर है जो कि इमेच्योर प्रीकर्सर सेल्स या एम्ब्रियोनिक टिश्यू से डिराइव होता है। कैरेक्टरिस्टिक ऑफ कैंसर सेल्स में हमारे पास सेल शेप इसकी इरेगुलर है, न्यूक्लियस इरेगुलर शेप का होता है, क्रोमेटिन इवनली डिस्ट्रीब्यूटेड नहीं होता। साइटोप्लाज्म में हमारे पास स्मॉल साइटोप्लाज्मिक वॉल्यूम आता है, ग्रोथ की अनकंट्रोल होती है और ये इमेच्योर और अनडिफरेंशिएटेड रहते हैं। कॉजेज ऑफ कैंसर में हमारे पास टोबैको, डाइज, इन्फेक्शन, रेडिएशन, स्ट्रेस, एनवायरमेंटल फ्लूरेंस के अलावा इनहेरिटेड जेनेटिक्स भी बहुत ज़्यादा रोल प्ले करती है। और इनहेरिटेड जेनेटिक्स के अंदर हमारे पास जो इफेक्टेड जीन्स हैं उसको हम दो ब्रॉड कैटेगरीज में डिवाइड करते हैं, एक ऑन्कोजीन्स और दूसरा ट्यूमर सप्रेसर जीन। यानी हमारे पास जब भी कैंसर जेनेटिक्स की वजह से आएगा तो हमारे पास टिश्यू ग्रोथ रेगुलेशन फेलियर होगा, यानी अब जो नॉर्मल सेल्स हैं वो एबनॉर्मल सेल्स में कन्वर्ट हो जाएंगे, यानी नॉर्मल ग्रोथ नहीं होगी, नॉर्मल फंक्शन असाइन नहीं होगा और नॉर्मल उनकी कोई भी चीज़ नहीं होगी। तो हमारे पास टोटल सारा सेल का जो रेगुलेशन का जो सारा प्रोसेस है वो ऑल्टर हो जाएगा। रिस्क फैक्टर्स में जेनेटिक रिस्क फैक्टर्स हैं। एनवायरमेंटल में हमारे पास हमारी सराउंडिंग, पैसिव स्मोकिंग, प्लेसेस वेयर वी लिव, वेयर वी गो, वेयर वी वर्क एंड प्ले। बिहेवियरल फैक्टर्स में हमारे पास स्मोकिंग, डाइट, एक्सरसाइज, अल्कोहल इनटेक। बायोलॉजिकल फैक्टर्स में हमारे पास एज, जेंडर, रेस एज अ रिस्क फैक्टर शामिल है। कैंसर के 7 वार्निंग साइंस हैं जिसको हम कॉशन कहते हैं और अमेरिकन कैंसर सोसाइटी इस वर्ड का यूज़ करती है ताकि हम कैंसर को अर्ली साइंस या अर्ली स्टेजेस पे पहचान सकें। A change in a bowel behavior, the bladder habits, a sore that does not heal, unusual bleeding or discharge, thickening or a lymph in the breast, indigestion or difficulty in swallowing, obvious change in the size, color and shape, nagging cough or hoarseness. Types of cancer include throat cancer, esophagitis, cancer of the esophagus. Esophagitis is the inflammation of the esophagus, and lung cancer, stomach cancer, bowel cancer, and prostate, testicular, skin, breast, ovarian, skin cancer, etc. Common causes of the cancer are tobacco, crispy brown food, ultraviolet rays, and alcohol. Types of carcinogens are those agents which cause cancer, and a few of carcinogens are very well known, which are asbestos, nickel, cadmium, radon, vinyl chloride, benzene, and benzene. And these carcinogens increase the chances of cancer. Physical or environmental carcinogens are the trusted source car exhaust fumes, industrial byproducts, and the cigarette smoke. Treatment of cancer involves surgery, chemotherapy, and radiation therapy depending upon the type of the cancer, the type of the pharmacological intervention that patient needs. Anti-cancer drugs classification is our topic, so we are going to discuss it in detail. Historically, the anti-cancer drugs are classified as alkylating agents, antimetabolites, natural products, hormones and antagonists, and miscellaneous. Alkylating agents. We have an idea that DNA is a double helix structure and DNA is coiled around itself. But for the replication process, DNA unwinds and both of the DNA strands are segregated and a new strand, a complementary new strand is formed. And this is the process by which the DNA replicates, so the DNA divides. But they are named so because of their ability to add alkyl groups to negatively charged groups on biological molecules such as DNA and proteins, so that they interfere with the cell DNA and inhibit cancer growth. They form cross-linkages between the two strands of DNA, thus stopping the process of replication, and ultimately no transcription or translation results. So the cells are not being divided. Our first drug in alkylating agent is cyclophosphamide. It is used in the management and treatment of neoplasms, including multiple myeloma, sarcoma, and breast cancer, and the nitrogen mustard that exerts its anti-inflammatory or anti-neoplastic effects through alkylation. Mechanism of action is that it forms the cross-linkages within and between the adjacent DNA strands at guanine N7 position. These modifications are permanent and eventually lead to programmed cell death. Well, we have two types of cell deaths. One is necrosis and the other one is apoptosis. Necrosis is the accidental cell death, while apoptosis is the programmed cell death. Decarbazines are used to treat myeloma that separate to the other parts of our body. The mechanism of action is not clearly well known, but it appears to exert cytotoxic effects via its action as an alkylating agent. Now, what were the alkylating agents doing? They were forming the cross linkages between the adjacent strands of the DNA within and in between it. So, other theories include DNA synthesis inhibition by its action as a purine analog. It means it adjusts itself at the position where the purine bases are located. So they interact with the ACH groups, thus they stop the DNA synthesis inhibition. Decarbazines are not cell cycle phase specific. It means that there are few drugs which are cell cycle phase specific. That means they act on a particular cell phase, but decarbazines are not cell cycle phase specific. It means they will act on every cell no matter what stage it is going through. While the stages of cells include the G0 phase, G1, S phase, and G2 phase. G0 phase is usually the phase of no growth, while S phase is quite an action phase for the cell growth. Nitrosoureus is extensively used in the treatment of the malignant brain tumors. The individual drugs most commonly used are CCNU and BCNU, and its side effects include esophagitis, diarrhea, gastrointestinal side effects, and dose-limiting toxicity to bone marrow. Antibiotics. We have heard about antibiotics, but here we are talking about anti-cancer antibiotics or the anti-tumor antibiotics. Any anti-cancer drug that affects DNA synthesis and the replication by inserting into DNA or by generating electrons that result in the production of highly reactive oxygen compounds, which we call as superoxide, which ultimately cause the breakage of the DNA strands. Anti-cancer antibiotics work by breaking the DNA strands. These antibiotics are administered by intravenous infusion for the treatment of lymphoma, leukemia, nephroblastoma, sarcoma, and the cancer of the testicles, the breast, the lung, and the stomach. Antibiotic drugs include doxorubicin, daunorubicin, bleomycin, mitomycin, and dactinomycin. Its mechanism of action is that the superoxides which are being produced by getting inserted in the DNA strands, they cause the breakage in the DNA strand and thus prevent the tumorous or the cancer cells to divide any further. Here is the strand being broken down by the superoxide. So its side effects include fever, chills, fatigue, hair loss, loss of appetite, nausea, vomiting, diarrhea, and sores affecting the mouth and the throat. Plant alkaloids are the nitrogenous base compounds frequently found in plants and are used in the treatment for cancer in humans, which include the traditional agents such as vincristine and vinblastine, and a few new agents. These agents are also known as antimitotic drugs, and the drugs are vinblastine and vincristine. Mechanism of action is that the vinblastine and vincristine bind to the microtubular proteins of mitotic spindle and prevent cell division during the anaphase of mitosis. They arrest mitosis and cause cell death. These drugs have the side effect to limit the cell division. Hormones are the chemical body messengers, and several forms of cancer are referred as hormone sensitive. For example, adenocorticosteroids and the sex hormones may influence the proliferation of the certain tumors. Types of hormones are adenocorticosteroids, anti-androgens, and anti-estrogens. These are the drugs which are involved under these hormones for their treatment of cancer, of their following cancer. Mechanism of action is that the adenocorticosteroids decrease inflammation via suppression of the migration of leukocytes. Wherever an inflammation occurs, the leukocytes migrate to that area. But adenocorticosteroids decrease inflammation via suppression of the migration of the leukocytes, thus suppressing the immune system by reducing its activity. So a cancer inflammation is not being resulted. Side effects include problem in sleeping, feeling restlessness, sweating a lot, mild mood changes, and antineoplastic indication is acute lymphoblastic leukemia and chronic lymphocytic leukemia. Mechanism of action of the anti-androgen is that they bind directly to the androgen receptor, thus they inhibit its availability and it increases the receptor's degradation, which is the primary source for metastatic prostate cancer. Its adverse effects are nausea, vomiting, and diarrhea, and its mechanism of action includes that the toximinophene and fluomenstrant are both anti-estrogens that counteract the effects of the estrogen by binding directly to the estrogen receptors, thereby working as an antagonist. They act as an antagonist to stop its action. So ultimately, these are the drugs which are used for the treatment of the cancer, as these are the anti-cancer drugs. Its side effects includes nausea, vomiting, and hot flashes, which includes the sudden sweating and what. So that was all about today's lecture regarding the anti-cancer drugs. I hope the anti-cancer drugs are being clear to you. Here we have discussed alkylating agents, antimetabolites, hormones, and antagonists. Drugs or the rest of the anti-cancer drugs are mentioned in the pharmacology book. You can also refer to books to study the anti-cancer drugs in a big detail. These slides were short and to the point to deliver the concept of the types of cancer and the anti-cancer drugs which are being used worldwide, while the miscellaneous drugs, which includes a quite handsome amount of drugs, is mentioned in the book. You can refer to the book too. So that was all about today's lecture. I hope you understand it well.